today we are talking about acne treatments. I'm Becky Wilkins, RN and health coach here at External Affairs, and I've got my good buddy Carol, our laser tech, our 20-year veteran laser tech. And so we're going to dive right into acne treatments and what we actually do in the clinic. I know the last couple of days we've been posting lots of information on acne, but we're actually going to do a live demo and show you what a treatment looks. So, Carol?
Yes.
When you have clients come in to see you for acne consults, you know, right now we've got a lot of young people out there that are breaking out, and you know, with back to school, that's becoming a bit of a concern.
Yeah.
I know even as a almost 50-year-old adult, being on holidays the last 2 weeks and taking up ice cream every day.
Ice cream, yeah.
Two poisons. Yeah.
Sunscreen
and eating ice cream.
Yeah.
Combining dairy and sugar for me has been a little bit of a problem. So I know there's lots of things that we can do in the clinic and lots of things that we recommend at home. So when somebody comes in for a consult, how do you decide what kind of treatment? Like, do you break it down for their age group or the type of acne? What do you usually do?
Usually I break it down for the type of acne. Typically if it's just little bits of congestion, sometimes that can be they've not been washing their face, they've been using heavy sunscreens, sometimes diet as well. So there's little congestive issues. Usually I'll start them on home care. A lot of times that will take care of that.
So when you say home care, I know that our acne line has specific ingredients in it that help kind of clean out the skin. So if you can explain exactly what the home care is.
So typically it starts with the salicylic. So salicylic is an anti-inflammatory. It helps to push that little plug that forms in the end of the follicle, which we lovingly know as blackheads. So it helps to reduce some of the inflammation. It kills bacteria to a certain degree. Then I will get them on some glycolic products just to get the skin cells turning over a little bit. We all need moisture. Even sometimes if your skin appears a little bit oily, I will get them on something that puts water into the skin as opposed to oil, just to try and normalize how the skin is functioning.
I think quite often, you know, especially young people at home, they tend to overstrip the skin.
Absolutely.
And you know, it's been my experience that the more you dry it out, sometimes the body wants to produce more oil.
Yeah.
So it's about getting that balance in there.
Yeah.
Yeah. So in the clinic then, what are our choices for treatments?
We do have a few actually. Home care obviously is always number one. That's something you're doing at home. You're doing it twice a day, so we're getting that contact on the skin. But in clinic, we have acne treatment. So we have a laser. Most people have heard of a blue light acne. With this laser, we do have that blue wavelength, but we actually apply it directly to the skin.
And what does that do?
So it kills bacteria.
Okay.
Basically, in a nutshell, that's what it does.
Okay.
So
is that an alternative to antibiotics?
It depends. It depends on the type of acne. If you have the really deep cystic type issues, you're typically going to want to go on something, maybe a medication, especially if it's systemic. So if you're having breakouts on your chest, on your back, the big cystic issues on your arms, that's definitely where we're going to want to steer you more to the medication.
Okay, so sometimes then you'll do the treatments, you'll get the patient on home care, and then you'll send them over to see Dr. Briggs, and he'll do some prescriptions. And we kind of come at it from all different angles.
Yes.
And I know this morning you and I were even talking about diet, and I know we both believe that, you know, diet is so huge when it comes to slowing down acne.
Yes.
You know, there's triggers. I know for each person it can be a little bit different.
Yep.
You know, some people it can be like the sugar, the carbohydrate sort of diet. Sometimes it's dairy. Peanuts stimulate, sometimes peanuts. Yeah. So we actually do have an elimination diet here at the clinic that we'll give free to those patients, just to sometimes take out those inflammatory type foods for even a month to see. And I know our lovely Ava here, I tease Ava a lot because she's young and beautiful and she can eat whatever the heck she wants and keep her gorgeous figure. But I know that you do experience that as well, right? If you're getting into a lot of the, especially the processed carbohydrates, all of a sudden you'll see that activity and that inflammation come up. So, all right, well, Carol, I'm going to let you take over. You're going to do the complete acne treatment. So you're going to use the laser and a combination with a light chemical peel.
Exactly.
Right? So when it comes to the chemical peels, you know, I know like Ava said that she's got plans Friday evening, so she doesn't want to actually peel per se. You can adjust that, correct?
Absolutely.
Okay.
Yeah, we can adjust that so that we just give her a really good hit of anti-inflammatory salicylic. She won't necessarily peel. We can keep it under control after using a little bit of VitaSoothe as well, just to add some hydration in.
Alrighty,
So
I'll
we're
let
going
you
to
take over.
put our glasses on. So the nice thing about our laser is that we have the ability to change the wavelength. What that means is it changes how deep into the tissue the heat goes. So if it's just really superficial, we have a very superficial wavelength. So we can target things that are more congestive. When you have issues where you have more almost like cysts and those deep painful blemishes, we can go quite far into the skin with this treatment.
So you're just adjusting the different filters that you're using on the skin?
Exactly.
Okay.
Now we'll put our glasses on. The other nice thing about this treatment is that afterwards, there's not really any downtime. You're going to feel a little bit warm. Your skin can be a little bit pink for an hour or so. But, you know, really you can go about your day very soon after having your treatment done.
And so by doing this combination treatment, so combining the laser treatment with a light chemical peel, we're really kind of targeting sort of everything, right? Like you're trying to get the inflammation down, but you're also dealing with maybe some of the marks
Absolutely.
that are left on the skin, right? The salicylic, especially if it's put on in layers, will really sort of peel that.
Yes.
Yeah. And so to give our viewers just an idea, when we're talking salicylic acid, you know, the home care products that we usually send people home with if they're spot treating, the salicylic is like a 2%, whereas the salicylic peel that we're putting to the skin here in the clinic is 20%. So it's definitely going a heck of a lot deeper.
All right, so we are going to proceed. So this treatment actually is really quite comfortable. It's just a little bit of heat going into the skin. And I'm going to repeat this process, probably at least 4 passes.
Okay. So Ava, on a scale of 0 to 10, with 10 being quite uncomfortable and 0 being nothing, where would you be at?
A 0.
A 0. Okay. Good to know. Do people have different sort of pain tolerances
Some
to
do.
the heat? Okay.
If they're really inflamed, they're going to feel a little bit more.
Okay, so it's almost like the more activity on the skin,
Yes.
maybe the more absorption of heat they're getting.
But it is, you know, it is quite comfortable. She'll start to get a little bit pink, and that's, you know, that's kind of the end point that I want to see. I want to see a little bit of pink there.
So you've got protective goggles on Ava, and that's just to protect her eyes from the light.
Yes.
Alrighty.
Yeah. And us as well. It's important to protect our eyes. How are you doing, Ava?
She's doing good. And so how many treatments would a patient do with this type of treatment?
Sometimes we can do 1 or 2 treatments spaced, you know, 1 to 2 weeks apart.
Okay.
If you're quite inflamed though, you may be coming in once a week.
Okay, and we have packages
Absolutely,
that we
yeah.
do? Okay. You know, I think that's sometimes the confusion when it comes to any treatments, whether it's skin treatments, anything like that. Sometimes people think that just like a once only is going to do the trick.
Right.
We have power problems over there.
Other problems.
Lasers are very temperamental.
Yes.
And they suck a lot of energy, so
Gets a little bit tired. Sometimes
Yeah.
it shuts itself off. So all the safety's built in. That's what makes it
that's
safe.
the way we are, right?
Exactly.
We get tired, we shut ourselves off too. Go to sleep at night.
Yes.
Yeah, and actually that's an interesting thing to even point out, that here in the clinic, you know, we're using medical grade lasers, which use a heck of a lot more energy than, say, the laser that you're finding in a tanning salon.
Exactly.
Right?
Yeah.
So they do tend to be a little bit more high powered, and because of that, a little more
There's a
temperamental.
lot of safety's built in as well.
That's right,
which
because if it
that's really key.
overheats,
Yeah.
right, and actually, I'll show everybody here, you know, the tips here, there's built-in cooling factors. So there's actually coolant that runs through the system, and when you touch it on the skin, it's actually cold.
Yes.
So it's actually lowering the temperature of the superficial skin, so that when it drives the heat in,
Yeah.
it's keeping that safety, that balance, which is what prevents, you know, burns is a concern with lasers and skin treatments. So when the system cannot maintain that temperature, it'll actually shut itself off. And that's a newer feature in lasers, especially the last few years,
Yes.
right? Where they're just, the safety factors are built in for us, which is nice.
nice thing about this laser too, we do acne treatments with it, but it's actually has filters that are interchangeable that we can do hair removal. We do photofacials.
And I think over the next month, we're actually going to be doing demos each week with each different type of system and different body parts and faces and different treatments, just to show our viewers kind of what the treatments look like and what the patient is experiencing during the treatments, because I know that's a big fear. It's, you know, people are afraid of being uncomfortable. And so this treatment, we don't put numbing cream on the skin. It's just not necessary with this wavelength. But some of the other treatments that you're doing on the face, like for the sun damage and things like that, you do numb the skin, correct? Okay.
Yeah, we make you as comfortable as possible. Again, this treatment is, you know, in the scheme of things, it's not too bad. You know, you do get a little bit warm.
Yeah.
But we just put topical gel on, and what that does is it just distributes the heat evenly. It's a little bit cooling as well.
So this is an ultrasound gel that's on the skin, and it's clear, so it's not absorbing any of that extra laser energy.
Right.
And she still looks pretty comfortable. She's smiling, so that's a good sign. She's not trying to whack us with her hand. We do have laser treatments that are not as comfortable as this one.
You know, the other thing that somebody like Ava that I would recommend as well is sometimes it can be a little bit hormonal.
Okay.
So again, sometimes we'll have them see Dr. Briggs to look at the hormones.
Balance out the hormones, yeah, especially if, well, and it's not just our menopausal women, it's sometimes, you know, a lot of these gals in their 20s and 30s are experiencing severe hormonal shifts.
Yes.
You know, which sometimes stress, sometimes diet, I think there's a lot of contributing factors. We actually see a lot of patients with polycystic ovarian syndrome, and sometimes they're presenting with not only acne but excess hair.
Yeah.
And sometimes when we see that combination, it's like, oh dear, we need to have somebody take a peek at your hormones and see if that needs to be corrected as the underlying cause. So,
and it can be where, you know, we need to have them on medication to adjust that.
yeah.
Or sometimes we'll recommend the EstroSmart or the EstroSmart Plus.
Okay.
On the borderline.
Because that helps sort of lower, or I guess maybe raise the progesterone levels and balance out sort of that fluctuation between estrogen and progesterone, right? So we're not getting those highs and lows. You know, with hormones, it's, you know, too little is bad and too much is bad. So it's really about seeing that balance right in between.
Feel warm at all? A little bit? Yeah, a little bit. So just where we see these major issues.
So she's going back over and kind of spot treating the troublesome areas, and really the goal is just take that inflammation down in those breakouts.
And I can actually, after doing the treatment, especially if there's a large cystic issue,
Yeah.
I can feel it reduce.
Is that right?
After
Wow.
treatment, yeah.
Wow. I think the body has incredible repair systems, and sometimes we just need to do treatments to push it along.
Okay, so we're gonna start there.
Wonderful. All right, so we're going to take that gel off.
And we can take our glasses off too.
Oh, well, that's better.
You can see she's a little bit pink, but nothing.
No, not too bad. And how long would that pinkness last?
Usually about a half hour to an
Okay.
hour. Yeah.
So she can go right back out and...
Yep. If you're just having the laser side of things done, you can put makeup on right away after as well.
Okay, so it's just when you're doing the chemical peel, then you want to leave the skin.
I like them to leave it for about half an hour to an hour with the salsilicone on there.
Okay.
And then they can go ahead and...
So Carol, if you can explain, if we can talk about the chemical peels for a minute, because I know we have different types of chemical peels, you know, with salicylic acid being one of them.
Yes.
And I know that with the salicylic acid, you actually leave it on the skin, so the patient goes home with it on the skin.
Yes.
Now, it's my understanding that the skin will actually neutralize the acid. It will actually stop it from working, I believe, after about 7 minutes.
Yeah.
Okay, so leaving it on, you know, just what penetrates into the skin, and or what's the
Yeah, it just
benefit?
penetrates into the skin better.
Okay, but they don't have to worry that it's continuing to
No,
work, right?
no, it's all
Because
self-neutralizing.
there are chemical peels that we do, like for example, glycolic acid is a little bit different. We actually have to remove it after 1 to 2 minutes to make it stop working.
Exactly. We
Okay.
have to neutralize it.
Okay. She looks so relaxed. I think I want to do an acne treatment. This looks fun.
All right, so we're ready for peel. So with anything cystic, I really, we do more than one type of peel. We have the salicylic and we have the modified Jesper's peel.
I'm going to turn this off, Carol, so everybody can hear you a little bit better. There we go.
Because of the high content of the salicylic and how well it works to fight inflammation, this is the one that I like to use.
I find, yeah, salicylic acid, it's very predictable, I
Yes.
think, on the skin, and it really dries up that acne quite nicely. And if you're just doing, like, you can, again, layer the peel to make it either less aggressive or more aggressive.
Exactly.
Okay. So there is an endpoint that Carol's looking for, and it's called, frosting, where it actually has a little bit of reaction with the protein in the skin. And so, sometimes when she starts to see that little bit of a white tinge on the skin, she knows that's her endpoint. Now we can see Ava, her toes are starting to wiggle a little bit. This is probably a little bit more uncomfortable than the actual laser treatment. It'll heat up for about 4 minutes. Now, if we weren't worried about sound, we would actually give Ava the cooling hose where she could actually blow cold air on her skin. And then after about 4 minutes, the skin starts to neutralize it and the heat goes away. So I always reassure patients, it's like, don't worry, that heat's not staying, it's just a few minutes and then it starts to go away. And when it goes away, it's kind of a relief.
How you doing, Eva? A little warm?
I'll be the cold air hose,
Yeah.
but like I said, we usually have a coolant where the patient can actually blow that cold air on their skin. So she's going back and she's just spot treating, the bigger breakouts. She's not going to put too much on Ava because Ava doesn't want to peel a whole pile.
And you're beautiful.
Alrighty, so now once you're done the chemical peel and once that heat has come out, do you put a little bit of the VitaSoothe on top or do you send them out just?
Because I like it just to stay like this for about a half an hour. She's going to be a little bit pink and it's actually the chemical peel that's going to make her a little bit more pink.
Okay.
Leave it for about a half an hour and then go ahead, and I always recommend VitaSoothe after.
VitaSoothe, okay,
Yes.
so VitaSoothe is that super hydrating product,
Exactly.
but without oil.
Yes.
Right.
And VitaSoothe contains vitamin E and vitamin F. Vitamin F being GLA, so gamma-linolenic acid, which again is an anti-inflammatory. So acneic skin tends to be deficient in GLA. So by putting that on top, you can take it internally. It helps to reduce the inflammation in the skin.
Awesome.
Yes.
Alrighty. Thanks, Ava, for being a tough cookie in there.